We welcome now Traci Barrientos, Executive Director, Lighthouse Academy for Dyslexia, and Kayla Reggio, Director of Curriculum and Instruction at Lighthouse Academy. Traci, Kayla, thanks for coming on.
Thank you so much for having us today.
You bet. So tell us about Senate Bill 2681. I'm just looking here. There are a number of authors of this bill, and this deals with certified academic language therapists. So, what
Correct.
exactly are we trying to do with this legislation?
So, we estimate that Mississippi has approximately 120,000 dyslexic students, most of whom will never be diagnosed. And we think part of gaining literacy scores in Mississippi includes addressing these students and their needs. So, this bill would allow us to have reciprocal licensure for those who are especially trained to deal with this population of students and their unique learning needs to come in from out of state. It also allows us to create programs and access areas like the Delta and other remote areas of Mississippi that don't have a university program right there in town.
So, dyslexia instructors, therapists, if you will, are they typically part of the staff at just like a local public or private school? Is that usually where that sort of instruction occurs?
Yeah, that's a great question. And the answer to that is typically no. It's not. We do not have the workforce for that, nor do we have the knowledge and general education for public schools of what dyslexia is, how to diagnose it, how to address it, and who can remediate it. And so, part of the first step we need to do in moving this sort of resources along the pattern for all students to get it is to develop a workforce. We have approximately 452 registered, licensed dyslexia therapists in the state of Mississippi, but we estimate we need about 4,000 of those in order to address the need because of the small student to teacher ratio.
Okay, so you said there how many total? 120,000, did I hear you say total?
We have So the Mississippi Department of Education said that they have 452 licensed dyslexia therapists, but we estimate there are about 120,000 dyslexic learners in our public
Okay.
school systems. So in
So
order
and
to
you
address that need, we'd need about 4,000 dyslexia therapists.
so is that to achieve a ratio that works out to what, about 30, I guess,
One to
right?
six, yeah, groups of 1 to 6 for students, and every therapist could probably see 4 to 5 groups within a day if they're not
Okay.
traveling from one
Okay.
remote area to the other. So those are all rough estimates.
And what about just the distribution of these therapists across the regions of the state? Do we have some that are lacking and some maybe we have what we need? I'm assuming that based on
Absolutely
needing to go from 400 to 4,000, we don't have enough, period. But then the
correct.
question is, of those 400, where are they located and where are they not located?
Exactly. So the majority of those are located in our areas like Jackson and Hattiesburg, where we have programs and university programs that offer a master's of dyslexia therapy, which is unique to Mississippi. There are other universities, which is why I have Kayla Reggio sitting next to me today, like Southern Methodist University, who train excellent therapists, but they're called language therapists as opposed to dyslexia therapists, same sort of training, absolutely capable of remediating these students, and yet they are incapable of being licensed in our state under current law.
And so, is that really, Kayla, what we're trying to do here? Maybe just to change the licensing requirements so that more people would be willing to perhaps pursue this as a profession and then qualify and then be dispersed into the field to help these children?
Yes, that's exactly right. We're looking at, what are those standards, those professional standards that certify an individual and ensure that they have the knowledge to address this special population. And those exist all over the country. We actually have a national organization that oversees the certification for these individuals. There's an exam that you have to pass, so it's a very in depth, thorough process to make sure that these professionals are prepared and ready to work with these students. But for those of us who are coming out from out of state into the state of Mississippi, because it's called a different name, there's no reciprocity there for that certification.
So, looking at the history of action on this measure, looks like it of course originated in the Senate, passed the Senate, got transmitted to the House, and then just last week passed in the House. So I guess we're at the point we're waiting for the governor's signature for this to become law. So sounds like we're there, right?
So my understanding is that we were still waiting for this bill to come to the floor. When we left the legislature, Jackson last Wednesday had passed out of the House committee.
That's
So
right.
you
You're
may
right.
have more.
I think you're
I
right.
was
Look
going to
at
say,
it,
do you
Rhino.
have good news for me today, Gerard?
No, I apologize for that. So today's the big day, of course, the deadline for committee action. So I think take a look at it, Rhino. That's what I'm seeing as well. So 318 was referred to Education Committee. 327 looks like it may have passed out of committee, but not on the floor yet. But
Correct.
I'm optimistic based on that, and certainly based on the large amount of support it received in the Senate, and also when you see so many authors involved, that's usually a good sign, as was the case with the Senate bill there. So it looks like we're in good shape. What else could we be doing, or should we be doing, with respect to public policy vis-a-vis these children that have dyslexia?
So we need to create some policies. The current law says that a diagnostician could be a psychometrist, a psychologist, or a speech and language pathologist in order to identify these students. And yet I'm unaware of any psychometry programs or psychology programs that actually have the expertise to tease out a
Yep.
dyslexia diagnosis. And so the Dubard School of Language Disorders, they do a good job of training their speech and language pathologists to identify dyslexia. We have a difficult time finding anyone else in the state that is training individuals to understand what they're looking for. When you consider that about 85% of our juvenile delinquents are likely dyslexic based on research studies, and that about 50% of the illiteracy rates in prison are people with average to above average intelligence and are dyslexic, I don't know that we can afford any longer to not identify and remediate this population. It's expensive to not do anything. And we're hoping to see the next several years some development of legislation that, one, provides for the resources in public schools to actually train their diagnosticians to identify these students, and builds the workforce to remediate these students, and not just in second and third grade. If we have a really bright kid that falls through the cracks and they're not identified until fourth, fifth, seventh, eighth, we had a student that came in that was 17 years and 10 months to our diagnostic site. And her reading was in the 2%, meaning 98% of students read better than she did. She was working really hard, dual enrolled, but was very worried about getting the ACT score she needed to pursue university studies. And she had not been diagnosed, and the school did not accept her diagnosis. So she will not receive those accommodations on her college exams. We're making decisions for people that affect their futures. And until our public schools understand what this looks like and how to actually let these kids tap into their talents to serve our communities in invaluable, important ways, we're going to have a human capital loss that's unnecessary.
We got about a minute and a half left. I was going to ask you, Kayla, have the tools to diagnose and treat, in the resources and just the methodologies, the therapies, have they improved through the years here?
They absolutely have improved. The amazing thing about dyslexia is we've got 30 plus years of really in-depth research that really is rooted in the studies of Drs. Bennett and Sally Shaywitz out of the Yale Center for Dyslexia and Creativity, that many more have gone on to kind of expand and also confirm their research. So dyslexia is unique in that we have more evidence to support where it comes from, how to identify, and what to do about it than we do about many other disabilities out there. So we know what to do.
We just need people.
That's right.
We need to get this law changed so we can get more people. I mean, that's the message.
That's right.
That's the message. Yep.
Yep. Got it. Traci, Kayla, appreciate you coming on, and we look forward to seeing this legislation get on the floor of the House, pass the House, I believe, into the governor's desk, and I believe Governor Tate Reeves would sign it. And we're making some improvements in this area. Appreciate y'all coming on. Thank you.
Thank you for having us. Have a good evening.
You bet. You too. We're coming right back, folks, in the Element